Hi, I am Dr. Pallavi Kalghatgi, and today we'll be talking about the menstrual cycle. So, what is the menstrual cycle? It is a term used to describe the sequence of events that occurs in a woman's body as it prepares for the possibility of pregnancy every month. And what is menstruation? Menstruation is the shedding or the monthly shedding of the lining of a woman's uterus. Now, what is a normal menstrual cycle? So, a normal menstrual cycle usually can last anywhere between 21 to 35 days, with an average of, say, approximately 28 days. So, if you are having your period at a fixed interval anywhere between 21 to 35 days, that is absolutely normal. For example, if you are bleeding every month for 24 days or for 25 days, that is absolutely fine. And the period days usually range from 2 to 7 days, again with an average of 4 to 5 days. In one normal menstruation, you would lose approximately 50 to 80 ml of blood. Now, if any of these parameters, like the duration of the menstrual cycle, the number of period days, the amount of blood loss during your menses, if any of these parameters do not fit the said criteria, then it is considered as an abnormal uterine bleeding or an abnormal menstrual cycle. Now, how would you know that you are bleeding more than 80 ml? How would you measure your menstrual bleeding? So obviously you cannot measure. So there are a few alarming signs that can tell you about that you're having a heavy menstrual bleeding. So if you are wearing a large pad and you are soaking it every 2 hours, or your tampon, if you're soaking it every 2 hours, if you are passing large cloths, if you're flooding in your washroom, or if you are feeling extremely tired and extremely fatigued and lethargic, if you feel like it is interfering in your social or your professional activities, then it is kind of significant that you are having a heavy menstrual bleeding. And the reasons for having this abnormal bleeding could be a wide set, right from stress to excessive workout to less workout, weight gain, endocrine disorders like PCOS or thyroid. All these could be factors where you could have an abnormal menstrual cycle, and it is advisable at this point to consult your gynecologist and to get further evaluated. What else could happen in a menstrual cycle? So in your period, you have pain. So what is pain during your period? That is called dysmenorrhea. Okay, and is it normal? Yes, a bearable amount of pain during the first and the second day of your period is absolutely normal. Your uterus is basically like a muscular structure, and during your period it is contracting, so that is why you are having the pain. A few ways that can help you release this pain is, if you should always stay hydrated, you should have a healthy balanced diet, avoid caffeinated or aerated drinks, definitely avoid smoking, and probably a mild exercise regime will also help in reducing the pain. You can use a mild antispasmodic or an anti-inflammatory medicine to relieve the pain, but of course you need to take that medicine under medical supervision. But please remember, if this pain persists and troubles you and is extremely severe, and it is coming in between of your work and your other social activities, or if it's lasting even after you've stopped bleeding, that is a sign, or that is a signal where you need to get evaluated. You will probably need a sonography, or you'll need a checkup, whatever, but you need to visit your gynecologist. So the next is, what is Mittelschmerz? What? Okay, so you don't need to know the name. You don't need to pronounce it, because I'm finding it hard to pronounce. But basically, it it means ovulation pain. Okay, so every ovulatory cycle, or every normal ovulatory cycle, a woman's has a follicle that is growing, and inside that follicle is an egg which is also maturing, and somewhere around the 14th day this follicle ruptures and the egg is released. This action where the follicle ruptures and the egg gets released is actually called ovulation, and it can lead to some amount of pain. It is usually one sided, or it could also be a general abdominal pain. This pain is basically the abdominal pain is basically because when the follicle ruptures, there's some liquid follicular fluid which gets accumulated in the pelvic cavity, and that is what causes pain. Again, using a mild antispasmodic is absolutely fine. But so when do you think that a woman or an adolescent female actually gets her period? So on an average, the first period comes around, say, the 13 years of age, but it can happen anywhere between 9 to 16 years. In the first 1.5 to 2 years, having irregular cycles every 3 months or every 4 months is absolutely fine. That is mainly because the HPO axis, or the hypothalamus pituitary ovarian axis, which is basically responsible for our menstrual cycle, has not yet become mature, and it has not yet developed its rhythm, menstrual cycle. So it's absolutely fine to wait it out. But however, if you have irregular periods and it is lasting for more than 2 years, then it is necessary to get evaluated. I think that was about today's topic. It was very basic understanding of what happens during your menstrual cycle. Also, I think this topic would help you understand more about yourself, the pains, the feelings, and everything that happens in between. So spread and share this video. It is very important we talk about periods, about menses, about your menstrual cycle, about what you feel during. So please share and please spread the awareness. Thank you.